Hey, it's Sandra L., board certified patient advocate, founder of the CHOMS MediHelps Foundation, also a managing partner of MediHelps LLC, and an author. And tonight I substituted Educational Wednesdays because I needed some self care on myself yesterday and I wasn't feeling well, so I canceled it until today. And I wanted to host today's video because there are a number of things that all patients, need to be aware of as we close out 2022 and we enter into 2023. But before I get started with going over the information that I want to show you or to tell you about that you should all know and share with your loved ones, what I do want to do is take the time to say this. The Patient's Voice by CHOMS, the foundation, is an open conversation, it's an open space. If you're trying to get into that space or you want me to become your friend, please go on to the CHOMS MediHelps Foundation page and send a request to become a member. We welcome all members. And a lot of times, what happens is that for some reason, I'm not seeing the request, and so people are emailing me. But just know that yes, I do want to continue to share the information with you, but I do need for you to send a request to the CHOMS MediHelps Foundation Facebook page so that you can be added to the membership because I don't want to leave any patient out. So now that I've said that, I want to go ahead and talk about some of the things that you all need to be aware of for this coming 2023. One of those important things that you need to be aware of is there are a number of state laws that will be changing or have changed already that you need to be aware of. So, regardless as to what state you're in, please take the time to go to your state website. You can put in with me is Illinois website, then the Chicago website, because not only do I want to know the things that are going live, the laws, the new laws or the fixed laws, whether they're for good, bad, or worse. Not only do I want to know that, but I also want to know in a city, has anything changed? I want to go down deep and find out what, if anything, has changed so that as I continue in 2023, along with along with the executive board and the advisory board for CHOMS, what I want to make sure is that we have and we're sharing the latest information available to you. That's what I'm hoping that is able to happen. Another thing is that you hear AR, and it's not funny, but what occurs, and it's not the doctor's fault because a lot of times our physicians do not know what's going on with their billing department unless they're like a one physician shop where they are hands on. But if it's a larger billing facility, when it's a larger medical practice, a lot of times they don't know. They have absolutely no idea what's going on. And what's going on is this. At the end of the year, they do an AR report, accounts receivable. And a lot of our physicians, especially our private practice physicians, not all, but a lot, they outsource their billing to overseas agencies. And what occurs is that a lot of the overseas agencies are not trained correctly. So what happens? They pull a report. If you went to the doctor or you have a loved one that has gone to the doctor, you're more than likely going to see this happen. I know me for the past, well, I can't even remember for how long, because I work and so does my husband, and so but he's the one that carries insurance. So a lot of times, what happens is that they'll say, "Well, you owe us this money." And I'll say, oh, no, I don't. And they'll say, oh, yes, you do. And I have to get on the phone with the insurance company and find out why did they deny a claim or deny it, reject it. Why did they deny it? And a lot of times what I'm told is, oh, well, you have other insurance when I don't. Or there'll be some other reason why they denied it when they shouldn't have. I've said this before and I'll say it again, especially at the end of this year. Do not pay a bill until you have the explanation of benefit statement from your insurance company. Your insurance company, they're not your enemies. You have to get comfortable, patients, with contacting your insurance company and saying, hey, I received this bill. Why am I getting this bill? So that they can explain it to you. If you don't understand an explanation of benefit statement, in the past, I could understand you saying, well, you know what? I didn't know. But there's no reason for you to say, I didn't know any longer. And that is because you have the patient's voice that you can send a comment to and say, hey, I got this, what's going on? You have GNA, which is Greater National Advocates. You can go to their website. There's a number of patient advocates. Will you have to pay? It depends on who you go to. But there are patient advocates that will help you to understand help you to understand your EOB. So you have places that you can go. And so no longer can you use the excuse, well, I didn't know, and who is I going to talk to, when you are paying bills that you have absolutely no business paying and expecting for you to get your money back. I'm telling you, it's a struggle. And, I've been in the industry for a very long time. And once again, I get the bills myself at the beginning of the year. Watch it. The first 3 months of the year, you'll start getting bills that you're like, why am I getting this? I went to this doctor like in January 2022. Why am I getting this? Because of their accounts receivable process. They're trying to get as much money as they can before they close their books. So if you're paying it thinking, oh, you know what? Hey, I'm going to pay it and I just call them and get my money back. It doesn't work like that. A lot of times what happens is that you'll be told, okay, well, we'll give you a credit. But I've asked you this time and time again. Why would you want a credit? Right? Like, who are you gonna, what if you don't like this doctor? What if you're like, I ain't never going back to that doctor again? And you're calling them to get your money that you found out later, a couple of months later, that you should have never had paid, and you're having a struggle getting your money back. People, let's be real. I'm telling you this for a reason, because I've seen it happen on too many occasions. And as a patient and as a board certified patient advocate, I can tell you it's going to happen again. I can't tell you if it's going to happen to you or your loved ones, but I know the deal. At the end of the year, which we're upon, in the first 3 months of next year, you'll start getting bills that you thought were paid, and you'll get tired of paying them, or you'll get tired of looking at whatever you're doing. You'll just really get tired of it. And it's a struggle, and it shouldn't be. So once again, no more can you say, I didn't know, girl, I didn't know, right? Because you're being told. No longer can you say, well, I ain't have nobody to ask, because yes, you do, right? So patients, we've got to be empowered to take our healthcare and our healthcare concerns and do what we must to make it work for us. So please be, on the lookout for those things. Once again, please be on the lookout. Look at your state's website. See what new laws, because I'm in Illinois. I just looked at the Illinois laws, and there's like 5 or 6 new laws that are coming out. And a lot of the new laws look like they're going to be helpful, but everybody doesn't live in Chicago, Illinois. I'm telling you to look at where you live at. see where those new laws what new laws went into effect or what old laws aren't there any longer. You have January 1st is when they become effective. So guess what? If January 2nd you wake up and you have to go to the doctor and you're like, I got to go to the doctor. And maybe you're thinking your insurance doesn't cover what you're going to the doctor for. Or maybe you're thinking you have a copay that you have to pay. Look at your laws, read your laws. Once again, if you need help understanding something or deciphering something, please send it to me. Send me an email. Quickest way to get to me. If you do not have my personal email, the quickest way to get to me is by sending an email to the patient's voice. I myself or one of the administrators will actually go ahead, and I'm actually seeing, and I'm going to answer questions in a minute. I actually see some questions, and I'm going to tell you the answers in a moment. I'm not seeing who's sending them, so I thank you for sending them. However, once again, check your websites. Another thing, for those people who are on Medicaid, which is the state-run Medicaid program, there will be a lot of people, because of the new law that didn't pass, there will be a lot of people that will be disenrolled off of the Medicaid systems. And these are state systems. Do me a favor. Even if you're not on Medicaid, but you know somebody that is on Medicaid, should they receive a letter from their state's public health department, I suggest and I highly encourage you, open that letter immediately. Do not throw it on your desk. Don't say, I'll take care of that next week. I'll get to it. You forget about it because life happens. You will be there is a chance that you will be removed off of the rolls of Medicaid. So what do you do at that point in time when you come off of Medicaid? Well, hey, you know what? There are federal health qualified centers that you can go to that might be able to service you. Normally, those FHQs, which are free public health clinics, normally they charge you on a sliding scale. But I'm telling you this so that you know, because, hey, we almost in 2023, and so I don't want you to retroactively try to fix anything. I want you to be proactive within the next couple of days. I want you to be proactive in getting what you need to get, whether it's for you, for your loved ones, someone in your community, anybody. Please, people, let's do what we need to do to protect our health. But you know what? Since we're in the week of Kwanzaa, let's do what we need to do to protect the health of those who are in our community and our loved ones, even if they're not in our community. With a lot of these programs being Medicaid-based, meaning state-based, a lot of these programs, they don't even have to live in your state. If your sister live in Kentucky or Minnesota or wherever, and you live in Illinois or New York or wherever you live at, call them and talk to them and say, hey, did you hear? Did you know? This is what you need to do. Please, once again, I can't, and I know you probably are saying, why does she keep repeating herself? It's just that serious. I'm looking at 2023 and I'm seeing, and because I already know it's happened so many times in the past and it really needs to stop happening. But you know what? In the past, we haven't had patient run or patient group collaborate patient groups that are looking out for the community. We haven't had them. Normally they're run by an organization or some type of organization that they're run by. And you know what? A lot of times they have patients in mind, but guess what? Bottom line is they have their own resources, and they have their own reasons for why they're pushing the information that they push out. Now we have a patient group that's run by a patient, one that actually has a myriad of chronic illnesses, I could very easily be like, you know what, I'm going to have all this information. I'm going to keep all these resources to myself. That's not what it's about. I'd love to have the resources, but it's so not about me, right? So that's why I do what I do. I have a passion for it because I know I've been there, I've studied it, I've lived it, I've seen it, whatever. And so I'm stepping forward now because I think all patients need to be educated, empowered, and engaged. Now, on to the next thing. I'm going to start answering some questions that I see come up. Where do we go? Share more where to go to look at these laws. If you live in, once again, Illinois, you can go to Dr. Google and you can put in Illinois health laws for 2023. If you live in Georgia, Georgia health laws for 2023. Google is good. You know what? I send people to Google for one reason. If it's something generic like this, and when I say generic, I'll tell you in a minute. When it's something generic where you're going, you have the information, you just want to see what's out there, I say go to Google. When it comes down to your health care, you can go to Google, but please, I beg you, make sure when you're looking up health information for yourself on Google that you are going to a Google site that is a peer review, meaning it's something that an educational institution has put out there, government agency has put out there, someone that's trustworthy. Please do not rely on Google to give you the answers if you are looking at the wrong site. It will not happen. It will not happen. And I see that we have Georgia, North Carolina health laws. If you live in Georgia, put Georgia health laws 2023. If you live in North Carolina health laws 2023. So whatever state you're from, that's the information that you're going to put in the system. You're going to put in the system what state you're from, health laws 2023. That's what you're going to do. That will give you the best information out there. So we've talked about the AR. We talked about looking out for in the first 3 months of the year for bills from this year that happened long time ago. And sometimes you'll get bills from years ago. Years ago. Because once again, a lot of people that are working, especially the overseas people that are working in billing, they don't really understand the American healthcare system. So a lot of times, and they're there to get money. So a lot of times they're going after money. They don't care who paid it. But if you're going to pay it, go ahead and pay it. But today is Cooperative Economic Day for Kwanzaa. And I'm telling you right now, there are a lot of people that are wasting money because they're paying for stuff that they have no business paying for. So do not pay a bill that comes in the first 3 months of the new year without looking at it, without having the EOB, without bringing it to somebody's attention, saying, hey, I got this bill, especially if it's 2 or 3 years ago. Hey, I got this bill in the mail. Should I be paying it? And I'm telling you that for a reason, because a lot of times if facilities or physicians hold on to bills for years and they don't get paid, they're not going to get paid. Because what the insurance company will do is the insurance company will say, hey, the insurance company will say timely filing. And what timely filing is each provider has a certain time limit that they are to submit bills to insurance companies. If they don't submit those bills on time, the patient is not responsible for it. The patient should not be paying for it. So when you get those bills and they years ago and you're like, hey, I don't know, why am I getting this? Stop paying it, even if it's $10. That's $10 you can have in your pocket to go get you some coffee or put in church or whatever you want to do. Give it to somebody homeless to help them. It's something you could do with that $10. Giving it to a provider that didn't follow the rules. Yeah, come on. Make the insurance company reps your best friends. Call them and talk to them with love. You know, a lot of times we call an insurance company and we get so upset and so angry because it's something that we don't understand. When you call a frontline employee at an insurance company, they're doing their job by telling you the policies and procedures that they are allowed to tell you. If they are not allowed to tell you, they're not. And you being mad and angry and upset is not going to help. It's just simply not going to help. It's going to make matters worse. What you should be saying, if you talking to an insurance rep and the conversation is going somewhere where you don't want it to go, you say, "Can I speak to your supervisor?" Now, they might put you on hold for a while, but that's okay. May I speak to your supervisor? Because that supervisor or manager has they have access to parts of the system that the frontline employee doesn't have access to, right? So they can't say and they can't help you. So, that's it. But I wanted to come to you today. I know it's been, I'm going way past the time that I wanted to go, but it was information that I really wanted everybody to have. Once again, if you are sending me emails and I'm not seeing them, or if you're sending me comments in the chat and I'm not seeing them, one is more than likely because I can't see it. Two, Facebook, StreamYard is not showing me the names of who it is that's sending it, so I really don't know. But I do appreciate you for looking. I do appreciate you for learning. I appreciate you for being a patient that's like, I want to do this myself. I want to be empowered myself. So yes, I want all the education I can get so that not only can I help myself, but I can help my family, my loved ones, my community, people, heck, that you don't even know. I've come across people in the doctor's office plenty of times that are just like, they don't know, they don't understand what's going on. And so I have to sit down and take the time to explain to them what's going on. So as we close out 2022, everyone from the Charms MediHealth Foundation, myself, as well as the executive board, as well as the advisory board, we want to take this time to say to everyone, happy 2023. We want to take this time to let you know that we're here. Where, if they don't have the answer, if you send it and one of my administrators don't have the answer, they're going to send it to me and hey, Sandra, could you look at this and, could you get back to this person? Please know that if you're sending me any kind of emails and saying, we're trying to get in touch with you, or can you friend me? No, go through the correct channels of going through MediHealth Foundation and asking to become a member and going that route. Once I know who you are and I get, know that you are here because you need our help, then, maybe I will friend you at that time. But there are too many people that need help, that seriously need help, mental health and physical health, and sometimes both, that I cannot take the chance and cannot take the time to, just have everything go tumbling down when we're trying to build up. So please know that I appreciate each of you. Please know that I thank you so much for taking the time to, listen, to watch, to share. It's all about love. I look forward to 2023, and I look forward to taking it up so many notches, because this 2023 is going to be the year of the empowered patient. We should have been here a long time ago, but we didn't get there. But hey, the goal is right in front of us. So from all of us at Charms MediHealth Foundation, once again, happy 2023.